go.
Hello, my name is Dr. Rodney Grobes here at Foot Pain Doctors of Jacksonville, here in Jacksonville, Florida. I just wanted to talk a little bit about heel pain, plantar fasciitis, and heel spur syndrome. When someone has pain at the plantar or the bottom of their foot, the symptoms usually are pain when you first get out of bed, or when you're sitting for periods of time and then you stand up, or you're standing for long periods of time. What happens is this structure right here is actually called the plantar fascia. So if you can imagine, when you stand up here, your arch automatically collapses just a little bit, which is normal. If you have excessive collapsing of that arch, it actually pulls on that plantar fascia there. At that point, you get tears either along this plantar fascia, which causes the pain within your arch, or you get tears right where this plantar fascia attaches to the bottom of the heel from that stretching, and that also causes tearing also. So that tearing causes swelling or inflammation on the inside of the bottom of your heel. And what happens, you can sometimes get other pain, radiating pain, going up either side of the heel or at the back of the heel, just from the pulling or tearing of that plantar fascia there. So the treatments of plantar fasciitis is actually to control that arch so that it doesn't pull and stretch that plantar fascia. There's several treatments which actually holds that arch up. One is a custom orthotic. There's other treatments such as injections of cortisone, anti-inflammatories. I also do class 4 laser here, as well as our pulse wave treatments also. But either any of those treatments do not help. The main thing to help this go away would be to control that arch. Now, there's lots of arch supports that you can buy over the counter and all, but most of those do not have enough support to control that arch. Here at Jacksonville, Florida, we have multiple types of arch supports and custom orthotics, which will actually hold that arch up to allow this to heal, so that those fibers are no longer pulling and tearing. It holds those fibers in place so they can heal, and that's what makes the plantar fasciitis go away. I can usually heal this 95% or more of the time just from the treatments that I do here at Foot Pain Doctors of Jacksonville, and that's usually without any type of oral medication in most cases. I mentioned other types of treatments. Again, there's anti-inflammatories, which is ibuprofen, aspirin, things like that. Those things, as well as the cortisone, what they do is actually get rid of the swelling at that point. But again, going back to the cause of the problem, which is not controlling this arch, the heel pain will come back again. So in a nutshell, to solve plantar fasciitis, we have to control that arch, to control the pulling on that plantar fascia that tears those fibers, and that's how you get rid of plantar fasciitis. Now, some individuals will also have heel pain outside of plantar fasciitis, but they usually come together. Now, when I speak of heel pain itself, it's pain on the bone itself and not the plantar fascia. So if we're standing for long periods of time without enough cushioning in your shoe and it hurts only on the bone itself, then a lot of times you have what is called a bone bruise or periostitis, which is the covering around the bone, and it can become inflamed, and that becomes painful just to touch the bone of the heel itself. Again, that's separate from the plantar fascia. And again, a lot of times they come hand in hand. Now, a heel spur is actually caused from, again, the pulling of that plantar fascia on the bottom of the heel. So when you get constant pulling where this is attached on that heel, it actually starts to pull, the bone starts to grow this way, which becomes a spur. Now, I've been doing this 30 years, and it's usually not the spur that's causing the problem, even if you push on it, because it's growing horizontal, it's not growing vertically. So it's usually a chronic pulling of that plantar fascia causing the spur to grow. So I get individuals who come in also stating that they have a heel spur, it's been hurting for years, and I instantly tell them that it's not the spur causing the problem, it's the pulling of that plantar fascia causing the spur, but it's the tearing of the plantar fascia itself which is causing the problem. Again, I've been seeing this for over 30 years. It's usually a fairly simple fix and treatment without surgery, and in most cases without any oral medications. And we'll be glad to help you here at Foot Pain Doctors of Jacksonville. I thank you for listening to this video, and God bless.